Angel Nation. We're here at Blue Pearl Veterinary Hospital waiting on our girl Evanna. The awesome news is that she's being discharged today, going to a step-down vet for regular vaccines, some laser treatment, some wound care, and then she'll be ready to go to a foster home. The recovery of this girl is absolutely mind-blowing and amazing. We're waiting on her, and hopefully they will. Oh, she's right here. They'll bring her soon. Hey, girl. Here's our girl. She's absolutely fantastic, and I'm so completely shocked about her recovery. Hey, girl. Dr. Winkler, are you going to tell us more about her prognosis or future?
Sure. Ivana came in last week, as I know you guys have seen the pictures, with maggots all over her head. Once we got the initial maggots cleaned up and got her healthy, if some of our patients that come in, just the presence of maggots can make them extremely sick, and so they had to get her through that phase. Once we finished that, we then went to imaging and take a look at the wound to see just how much was involved. We'll look at that in just a second, but what we found is all of this appears to be both current bite wounds, and there's evidence of old bite wounds. This dog has certainly been attacked by multiple times based on what we see on our images. Since that point, we have been treating the wounds, and we'll continue to work with wound care on her and see if we can get this wound to close completely on its own, or if she ultimately ends up in a second surgery to close the wound. You'll see the blue material right in the center of her head. That is basically a deep hole. I'll be able to show you that on her CAT scans in a second. But it's a deep hole that when she came in was completely filled with maggots and debris, and then the maggots were filling the right eye socket. Once we got, again, everything cleaned up, our ophthalmologist took a look at her, and she's got an ulcer on that eye, but it looks like the eye on the right side is going to be visual.
Wow, that's amazing.
In addition to the wounds on the head, the current wounds on the head, you'll see this ear was split all the way across, and that's a full thickness split. She basically came in with two big ear flaps that we were able to salvage and repair so that we don't have to remove the ear at all. She's got multiple bite wounds all across the rest of her face, and she's got evidence of old scarring on her legs that is probably also due to bite wounds, both some current and some old. She's severely underweight, has not had access to good nutrition for quite a while based on this. She came into us weighing about 38 pounds, and she's got quite a ways to go to get her up back to a normal weight. You can see her bones, her ribs, her bones, her shoulder blades right here, which is all way too obvious, and she should have a lot more muscle and tissue on it.
So all the scabs right here, like I'm touching her, and she's completely full of scabs on her abdomen. Are
likely all old bite wounds, yeah, all over her body.
It's amazing you got to keep your eye, and it is visual. That's absolutely fantastic. So what is her treatment plan for the future? What is ideal for her?
Ideal for her, a couple of things: basic care, nutrition, get her back up to a normal body weight where she should be. That's part of just general care of the body. And then specific to the wound, she'll get bandage changes every second or third day. If we can get this to heal without having to go to surgery, it'll probably take a couple of weeks to fill in, but I think we'll do that. You'll be able to see on her CT that in the center of the hole there, in the center of that blue material, there's actually a hole through her skull into her frontal sinus that she came in with, and had maggots not only around that you could see, but also deep into the sinus that it took us a couple of days to be able to get rid of all of them and get that cleaned out.
I mean, isn't that almost a miracle that this dog was walking around with a skull in her skull?
When you look at the location of the images, she was millimeters away from having a bite wound go through that eye. Obviously, the bite wound through the skull happened to land in the frontal sinus. Had it been just a little bit back from there, it would have gone straight through into the brain, and then the likelihood of survival would be very slim. That's even with a healthy dog. When you deal with a dog who is As malnourished as this one is, wound healing takes a lot longer. Risk of infection is a lot higher because the body just doesn't have the reserves to take care of itself.
So she's a small miracle.
Yes. Yes, oh, my dear.
She's also heartworm
I don't
positive.
have any food for you.
She's also heartworm positive. So when do you think that she will be ready to start undergoing heartworm treatment?
I think I would like to see her gain a little bit of weight and just overall body health be in better shape before we put her through the stress of heartworm treatment. That can be tough on these guys, and I want her in good shape before we actually start that.
I mean, she can sit for us. She's absolutely amazing. She's so good and so sweet and so gentle when she takes treats. She's obviously very food motivated, which is great. All right, so Angel Nation, this was Ivana, and Dr. Winkler will about now show you our imaging, our radiographs. This is very interesting for medical people, but it will explain, we'll dumb it down for non-medical people.
So on the right side, we've got a picture of her skull. This is her nose. Her nose is here, her teeth. Her eyes will sit right about here. These are the sinuses, and the brain cavity is back here, the neck, and down through the airway. On this side, we're looking right at the front. Here's her canines, and we're looking at her nose. And we're going to start looking and following that as we go back through the head. And you'll see the teeth. This is where she had significant damage to one of the other teeth in the is an old injury. As we continue on, this is the nasal cavity. This is the roof of your mouth, the hard palate. And then you'll come in right here. You'll see there's a big hole there that doesn't belong there. This material right here where the arrow is small fragments that used to cross here. This is an old penetrating injury, and at this point, given the rest of her history, I'd have to assume this is a bite wound. It's completely healed and doesn't cause her any problems right now. You can see this is a normal side of the nose. This is abnormal side. It's been damaged pretty heavily in the original injury. As we keep going back in our head, we'll come up, and this is the eye on the right side. This is the eye on the left side. This is, again, all of the nasal cavity. And as we start working our way back, here's our frontal sinuses up here and here on this side. And now you'll see the skin comes up like this and comes up like this. This whole area, there is all tissue missing. There's nothing there. That's the big hole. There's the bite wound directly into the sinus. And we'll be able to follow that back, and you can see the hole as it finally closes up all the way back to the back. And then we've got the brain coming in at this location. So you can get a feel for just how big this hole is that we've got to get to refill with skin and muscle, because that's all missing, and that's where our blue bandage is right now. So that's where she is. You'll have some other images that we can get posted that you'll be able to see damage to the skull all the way down right to the orbital rim or the edge of the eye, and see how lucky she was and just how close it actually was.
So despite her horrific wounds, she's actually going to be okay.
I think she's going to do fine. She's got a small ulcer on that right eye. Most ulcers heal well. They feel at this point her vision is probably going to be completely normal in that right side once things completely heal. Our biggest concern is getting the tissue to heal on her face, rebuilding her body, and just making sure as that tissue heals it doesn't cause any shifting of her eyelids that would cause her problems down the road.
So there is a possibility that she might need additional surgery.
She may need another surgery to completely close the skin up between the eyes. If it closes on its own without problems, that is great. Sometimes as they close, they begin to have some pulling or some scar tissue. What we want to make sure is that scar tissue does not change the shape of the eye that would cause her problems. If we see that beginning to happen, then we'll have to come in surgically and close the wound so that we don't have damage to the eyelids.
Okay. And the way we are managing the potential risk of infection is we're sending her home on multiple antibiotics.
Right now she'll go home on antibiotics. The bandage is actually the inside of the bandage is actually a surgical grade honey, which is used to minimize infection and help decrease bacterial contamination, bacterial counts. She's responding really well to it. What's underneath there right now looks very, very healthy, but she has a lot of healing still to do.
But it's amazing where she's gotten, you know, that she's gotten this far in just a few days. I mean, considering where she was.
She, you know, I saw her first about 5 days ago, and at that point she was minimally responsive. She didn't pick her head up to look at you. She didn't do anything. She was sick in part because of the amount of maggots that she had infesting her, and the turnaround she's made in the last 5 or 6 days has been tremendous.
We really appreciate all you have done for her and all you do for all dogs. And our supporter have any questions that Dr. Winkler can ask to, or we can get this girl on her way to a step-down vet, get all her vaccines, and start her to head to a foster home. Because she needs some love, and she needs some care, and she needs some food, obviously. Because that's all she had this morning. So.
Does anyone have any questions for the doctor?
It's pretty thorough. Thank you so much.
About Ivana's progress and future?
Keep supporting us. That's the only way we can save dogs like her.
Mm-hmm.
Here, come here.
Need help. 98% volunteer.
Mostly just a lot of
Here we
thank
go.
yous.
Thanks. This is why we do it.
She is ready to be loved on. Look at her poor little legs.
Ooh. These are old though, right?
Most of those are old. Some of them you can see scabs on them when they're reasonably fresh, but a lot of them are old injuries. She's been attacked and bitten multiple times over her life.
Yeah. Melody, that just answered your question.
She's been through hell and back, but no more
No
pain
more.
for you.
She's safe.
No more bad things.
Perfect for everyone.
Thank you again, Angel Nation, for your support and your love and your prayers for her. They obviously work together with great medicine. And we'll just keep following her story and giving you updates on her life. She's going to be okay. That's all that matters. That's
Linda, we did mention the heartworm issue, but I believe Dr. Winkler said we're going to get her healthy and strong first before undergoing heartworm treatment.
That's good. She's such a miracle.
Yes.
And she's so sweet. I mean, she's just like, I know.
Yes, she's just so sweet,
I'll be available soon, y'all.
so
Not
calm.
that
She
sick.
feels safe now.
She is. And she needs a better
I
time.
don't think she's ever
Make
felt
sure
safe.
you follow our Facebook page to see all of her updates and updates of all the other dogs and cats that we save. She is going to her foster home today. So she's leaving the emergency vet today, going to her foster home today, and then most of her vet needs will just be at
Girl, sweet.
a regular vet office. She needs her.
Yeah, well, she's gonna go to a step-down vet today for rabies vaccines, and then deworming, the standard vetting that we have to do on our dogs, microchip, and then she'll go to a foster home, and she will have regular appointments, wound care, bandage changes, and rechecks. And her eye needs to be rechecked in about 2 weeks. She's on medication for the eye, 2 different drops, and she'll have to be rechecked too on her wound in about a week.
Yeah, I'd like to keep a watch on those wounds and see her probably once weekly to make sure it's healing okay and that there's no problems.
Perfect.
Linda, the Facebook page is just Angels Among Us Pet Rescue, or Facebook / Angels Rescue. She doesn't have her own page yet. And no, this sweet couple is not a couple, but they are wonderful volunteers. Frank and Dixie, photographer and marketing volunteer, and Chris on our vetting team.
Can you show people how to know how to sit? Good girl.
And you may recognize Chris. She was a foster parent for one of our other special needs pitties. Let's see if anyone recognizes or remembers which dog that was.
Our baby Phoenix.
Not for you to say.
I know, I'm sorry.
But Chris will be taking
She's amazing too.
this baby home. She is just Such a wonderful foster. And if you're interested in fostering for angels, please visit our website, angelsrescue.org. If you're interested in volunteering or donating, please visit our website as well. Thank you for staying with us today. And thank you, Dr. Winkler. Blue Pearl, thank you.
Sweet girl.
Oh, but Ivana, let's show us your sit before we go.
6. Well, she only does it for food, so 6.
Smart.
Good girl.
Oh, good girl.